I'm Neville, then this is Ye Kai. He will be helping me with the assessment. So I need your consent to do the assessment.
Yeah, sure.
Sure. So starting off, we'll just look at the way Ye Kai stands. So from the frontal plane. So from the front, we will check with the level of the ASIS, the level of the knee, whether there's any lateral pelvic tilt. We'll be looking at the way the foot is, and he's standing on the foot, so we can tell the forefoot is abducted, there's plantar flexion, and there's eversion. So next, I will have you turn, face the mirror, so we'll assess your standing posture from the side. Then we can see whether there's any excessive hyperextension or flexion of the knee. And if you turn the other way and face me now, face me, yes, we can tell that from the side view, one knee is more into flexion than the other. So the right, from behind, I think we can see a shadow of the right knee being more extended than the left. Okay, so also from this view, I will have you do a squat. Yes, and up. So we will be looking at the thoracic position, the knee position, and also whether the foot is externally rotated with sufficient abduction or abduction and adduction. Same thing, I will have you do a squat with your hands overhead. So same things we are looking out for is the thoracic mobility, hip and knee flexion. So once again, turn face the camera, then you'll do a squat here and the overhead squat, also checking the different planes. Very good, thank you very much. So next we'll have you start further behind, then walk towards the camera. So thank you. So we're looking at the knee flexion, knee extension, hip flexion, hip extension, the toe, and the foot position. One more time. Yes. Okay. Very good. So I'll have you lie down, then we will start the assessment in supine. So we'll shift the camera closer towards the bed, towards the plinth. So maybe around here. So the first part of the assessment will be observation. We'll be observing the hip positioning. So for Ye Kai over here, he has a bit more external rotation of the hip in resting. And if we straighten the knee, I'm not sure whether the camera can see it, but he has a gap under underneath the knee. So this shows us there could be some increased tension in the hamstrings. Okay, you can relax as much as you can. So what we'll be looking out for is also any obvious signs of swelling in the knee. Okay, also in this position, we should set the knee facing upright, the hip in neutral position. Then we can assess the position of the patella, whether there's any patella alta, sitting position of the patella. Is there any tilt towards the lateral or towards the medial? Okay, then another part of observation is we can look out for any signs of surgery. So next we'll be checking on the range of motion. So we'll start off with the range of motion of the hip. So I want you to bring your knee towards your face as much as you can. So checking the position of the hip. So same thing, go inward or outward. Yes. Okay, the other way. So full range of hip of motion for Ye Kai over here. Next, I want you to straighten your knee as much as you can. Yes. So we'll be checking for knee extension here, whether there's any deficits. If we lift up very gently just to show the camera, there's a very slight deficit in knee extension maybe of 2 to 3 degrees, that we can verify with the goniometer, and into flexion, bring your knee as close to. So this is the active range of motion. So after active range of motion, what we can do is a bit of an overpressure, put it into more flexion and more extension. Any pain?
No.
When I'm putting pressure? No pain. Okay, very good. So once we are done with the range of motion, we can check the mobility of the patella. So grab the patella at the side, we can move it medially, laterally, superiorly and inferiorly. Okay. If the patient is complaining of knee pain, what we can do is a patella grind test. So we'll tilt the patella towards the medial side, tilt the patella to the lateral side, assess for any pain. So we are pushing directly in the anterior superior force. Okay, no pain. Okay. So there's for Yekai over here, there isn't too much medial laxity or lateral tightness. Okay, so next part of the assessment will be checking for specific conditions. So for more simple one, the first one we will check is for joint line tenderness. So palpation across the medial joint line on the medial side. So palpate throughout the whole joint line, feeling for any tenderness. Okay, this is to check for the meniscus, so no pain, nothing. Okay, so in this position is also where we do our anterior and posterior drawer test for the ACL and the PCL respectively. So for anterior drawer test, so we'll put a distraction force over the tibia, thumbs will be over the meniscus to feel for any laxity. So this is the anterior drawer test, distraction away. And then this is the posterior. So we'll, same thing, we'll be feeling for any laxity inward. Okay. So for next will be the medial collateral ligament, the MCL. So similarly, we are feeling for, we'll palpate for the ligament over the medial aspect and do a slight flexion of 15 degrees and go into extension while adding a valgus force. Okay, should feel the ligament having a bit of tension when adding the valgus force. Any pain?
No.
No pain. So similarly, for the lateral collateral ligament, we'll place a finger over the. We'll place the finger for palpation over the lateral collateral ligament and perform the, with this time into slight flexion, but then with a various force. So, slide. Any pain?
No.
Okay. After this, also for the ACL, we can do the lockment test. So one arm will support the femur this way. Yes, relax. So these two fingers will be over the meniscus, feeling for any laxity when we are doing the distraction. The left arm will be, in the other hand, will support the tibia, a bit of external rotation and more distraction away. So not much. What we can do is also pincer grip for on top of the medial joint line, feel for the laxity or the translation of the tibia when distraction force is provided. Okay. And for ACL, what we can do is also the pivot shift test. So the knee will be slightly into flexion, external rotation, and place into extension and go into. Okay, relax. So to start over again for the pivot shift test, the knee will be straight, externally rotated, a bit into external rotation and bring into flexion. So a positive test will be a pain or a clunk when the knee is placed back into flexion. Okay. So next will be to test for the meniscus, McMurray's test. So for McMurray's, right? So we'll feel for the meniscus, same thing, into flexion. We'll compress the meniscus in the medial line. For the medial meniscus, we'll add in varus force, and then go slightly into extension, so we can repeat this test. Anything? So for the lateral meniscus, same thing, fingers over the joint line, palpating for the meniscus, keeping the compression, this time adding a valgus, a varus force, and external rotation. Same thing for full flexion into extension. Okay. Then next will be, I'll have you lie facing down, turn around. So we'll be doing an abs release test. So same thing. We'll have the knee in a 90 into flexion, palpate for the meniscus, go into extension, squeeze the meniscus, internally rotate just to feel for the meniscus. So, alright. So this one for the medial meniscus, we'll do an external rotation of the tibia. This way will be better. Alright. Anything? Okay. Last thing to check, I will have you turn around for one last time. So we can check for the hamstring strength in the supine position. So as you can tell, Yeka has very tight hamstrings. Okay. So that concludes our knee assessment. Thank you very much.